This video describes an arthroscopic technique of posterior labrum suture of hip joint by a two-step cam rotation switching bird's eye view. After anesthesia, the patient is placed on the head low and feet high position, and the affected limb is pulled distally. Preanal column and C-arm fluoroscopy were not used throughout the operation. After traction, the surgical portals are marked. Step 1. Approach, establishment, and transverse capsulotomy. The arthroscope was placed into the central compartment through the AL portal. Radiofrequency is planted through the MA portal and then meet with the arthroscope camera outside the joint capsule. Radiofrequency and shaver are performed alternately for transverse incision and articular capsule. Step 2. Pincer arthroplasty and labrum assessment. The pincer deformity exposed after joint capsule is cleared along the upper surface of the acetabulum. Use a spherical grading drill to complete the pincer arthroplasty. Then fully assess the location, type, and scope of the labrum injury. Step 3. The two-step cam rotation switching bird's eye view technique for posterior labrum suture. Once the labrum tear is found to be located before 12 o'clock in the acetabulum, it is a posterior labrum tear. There is no need to place the observation and operation approach. The surgeon first rotates the arthroscopic camera in the hand clockwise. Under the arthroscopic view, the field of view changes from directly opposite the labrum to directly above the acetabulum, which is called the bird's eye view. At this point, the suture hook passes through the posterior upper side of the torn labrum near bird's eye view and emerges from below its anterior side. Rotate the light source line of the camera so that the arthroscopic view is aligned with the exit of the suture hook. Speed the PDS wire out of the suture hook and bring an athlete bond wire using the through-line technique. After the high-strength wire is formed into a lasso loop in vitro, a 2.9 mm knot-free anchor is used to fix the labrum. Step 4. Cam arthroplasty and capsular suture. The traction is relaxed and the hip joint is flexed. Radiofrequency is used to incise the joint capsule longitudinally. After full exposure to the cam deformity, completing the cam arthroplasty with the spherical grading drill. Finally, the articular capsule is sutured longitudinally and transversely.